I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Dr. Deuk here at the Deuk Spine Institute. I'm with one of my patients who's traveled to us from Mississippi, and he came here for the Deuk laser disc repair to be done for a herniated disc on his neck, and he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well, no problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
This is Dr. Deuk. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. And it just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. It is February 23rd, 2022, and I'm here with one of my patients who has traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much, much better. 26 years ago, I had a fusion of C6-C7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March. And I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did a
he
lot
did
of
a
Googling.
lot of research, and we found Dr. Deuk to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing, and that he really, really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be, because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
Surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the way
Yeah,
up.
just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, 2 of them, C4-5, C5-6, and the herniations were literally sitting on the nerve, and we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny, and here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. Well, most of the time it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Deuk will give you a free look-see on the MRI. It's well worth your time. And he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because you know, we got a little bit of a nest egg, and sure, it's gonna cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks, we'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake. Dr. Yara Deuk-Majan, CEO and founder of the Deuk Spine Institute, here with you today on July 26, 2022. We have just completed a single level cervical Deuk laser disc repair, and this is a patient who has a herniated disc at C6-C7 when they came to us from Washington. He is a interesting history. He's in the military, in the Air Force, and was involved as a pilot for many years, refueling jets. And he came to us with pain in the neck and then going up into the back of the head and some arm symptoms on the left side. With most people will have a numbness or a tingling or weakness in the arm, sometimes even pain going down. We call that radiculopathy, and that's from irritation or compression of the nerve root. You can actually see here where the nerve roots are. The nerve root's the yellow thing, and the little swelling here is called the dorsal root ganglion. You can see it right there. And you can see how a herniated disc, the red thing, can actually press against the nerve root, causing arm symptoms because the nerve goes down your arm to your fingers, or it could cause pain going down the arm. So he had herniated discs primarily on the left side that was compressing on the nerve root. We went in through the disc with the scope, and I removed all the herniation in the back of the disc on both sides. There was actually herniation on the right and left side at the back of the disc. So we cleaned out the whole thing. He had what's called the subligamentous herniation, meaning it's a disc bulge. Most people would call it a bulge, but it is a herniation. Anytime you rip through the posterior annulus and the jelly gets pushed in, that's a herniation. There's 5 types of herniation: class 1, 2, 3, 4, 5. Pretty much anything that's class 3, 4, or 5 herniation involves an annular tear and a herniation of the nuclear through the annular tear. That's going to cause symptoms. So grades 1 and 2, call them grades 1 and 2 or class 1 and 2, they don't usually cause any symptoms at all. That's because the tear is only in the inner part of the annulus. So you have to get to the outer part of the annulus to get that inflammation and pain. Surgery went well. Patient had a nice thin neck. Spine was anterior. We had no problem getting into the disc. You can go back and see on the x-rays that we did, we were able to access the C6-7 disc. X-rays are used for both navigation as well as localization for the proper level. And this patient's avoiding a fusion. They don't want a metal plate in their neck. They don't want metal discs. Deuk laser disc repair has better results, and it's safer and a faster recovery than artificial discs or fusions. All right, we're going to take our first question.
Yes, our first question, well, it comes from Facebook. It's Joshua Steinman.
Joshua Steinman on Facebook, thank you for asking question.
It's not a question, but he is admiring you. Dr. Deuk talking is the best. Very informative and straightforward with the staff. I need him for my neck and back.
Yeah, thank you very much for the compliment. I apologize that we don't have the audio with today's surgeries. Our voice thing broke, and we're working on getting it fixed. So all we were doing, unfortunately, is just a video stream. But that said, that's why I'm here now to answer your questions and kind of explain what we're doing. So thank you for the compliment. We love broadcasting surgeries because we want people to see everything being done from beginning to end and learn the truth. Most surgeons won't broadcast their surgeries. They don't want you to see what's going on as they muck things up in there, because their surgeries with the ACDF and the artificial discs are very traumatic. They're gory, they're bloody, there's meat and potatoes going on, and if you saw it, you would be scared to death. So people are already scared of fusion. And if you actually watched a fusion or an artificial disc, which is pretty much the same thing, you're going to see just how damaging it is to your body. And then you're going to go, wow, what a difference the Deuk laser disc repair is, where there's no damage except for a little cut, and then everything else is perfect down there, and we just go in and remove the herniation. You could actually see in this video during the surgery, there were lots of pieces of herniation coming out. There were more than I expected, but what that shows is that herniations aren't just one event where you push out a piece of jelly. There are actually multiple events where you get multiple pieces of nucleus squeezing out through that little tear. So by the time I went in there, this guy had had really bad symptoms over the last 4 months. And when I went in there, we got out at least 5 or 6 pieces, and I showed you a really big piece, right?
Yeah, I got it.
That was the biggest piece of herniation. All right, what's the next question?
The next two questions come from Reiko Pilot on YouTube.
Hi, Reiko Pilot. Thanks for asking again.
And they asked, how is the patient positioned during surgery? I often hear a pulling on arms to get the guide wire placed right. And x-rays look like very arched back neck, so I was wondering what it looks like.
Yeah, great question. So Reiko Pilot's asking, how do we position these patients for surgery when we're operating on the neck? The answer is they're laying on their back, kind of like if you were laying at the beach, just laying there looking up at the sun. And we've got their neck like this. There's a tube in their mouth, so you can't see that. That's all draped. It's all covered. So what we're actually seeing, is something like this right here, where you can kind of see the neck. And I'm pushing right here and touching the spine, and then putting that needle in right there where I need to get into the disc. So these patients with the cervical are all intubated. They got an endotracheal tube coming out. We got an anesthesiologist, Dr. Berndes, who's keeping them safe and good at keeping the heart going, lungs going, getting good oxygenation during the surgery. And then I'm just going right through here. So that's what you're seeing. All the chest is draped.
And then his next question is there a group of people, age, gender, profession, anything, that you see and operate on most commonly?
So great question. Is there an age group or gender of people that I operate on most commonly with these disc problems? No, herniated disc is really symptomatic disc herniation, symptomatic disc bulge, symptomatic degenerative disc disease. It's all the same thing. All right, it's a tear in the disc that the jelly is pushing through, and it's causing inflammation, and that causes the disc to degenerate over time. It causes pressure on the spinal cord or nerves. It can cause balance problems if its pressure on the spinal cord is bad, clumsiness in the hands, numbness, tingling in the hands. These problems are very common in people, and they're really, unfortunately, mostly misdiagnosed. In other words, doctors don't know how to make the diagnosis. So nursing homes, unfortunately, are full of people with herniated discs in their neck, pushing on their spinal cord. They have bad balance. Balance is a big issue as people get older. They lose their balance. Well, why are they losing their balance? Nobody ever bothers to look into it. It's because they have herniated discs in their neck with spinal stenosis, pushing on the spinal cord, causing bad balance. It's totally fixable with surgery. But the problem is, if the patient's doctor doesn't think about it, they don't get an MRI, they end up just getting worse and worse. They end up bedridden. And that's no way to live, folks, is bedridden, especially with a problem that's totally fixable. So that's why we do these broadcasts, to raise awareness of the truth. We don't want people suffering and having a poor quality of life. We want people to know the truth, figure out what's wrong, get the MRI of the spine, send it into Deuk Spine, get our opinion. We'll tell you exactly why you're having the problems you're having from your spine. As far as age, gender group, the herniated disc problems are always related to some history of trauma, whether it's a whiplash in a car accident or a fall or a sports injury. Somehow the spine is getting suddenly jarred or moved, and it causes a tear in the wall of the disc called the annular tear, and that's where the herniation happens, and that's what causes all the problems. There really is no age. Of course, it doesn't really happen commonly in kids, young kids, but we do start seeing it in teenagers, especially as teenagers get older, we start seeing disc problems. The disc is the source of all the pain 80% of the time.
And that would be it for the questions.
That's it for questions. Thanks for joining us. Our next patient is coming to us from the Virgin Islands, and he is in construction. He has a bad back. He's got a couple of disc herniations, bulges, and he's got horrible back pain. And we're going to be doing a bilateral L4-5 because he's got leg pain going down both legs. So we got the L4 and L5 nerves getting pinched on both sides in the lateral recess, which is just, to the side of the disc from the center, and L5S1 is on the left side. So we're going to be fixing bilateral 4-5 left L5S1 with the Deuk laser disc repair. Once again, he's been suffering with pain for a long time. We know we can fix it. He didn't want fusion, and he came here for the surgery with his lovely wife.